when you hear the word diabetes, what's the first thing that pops into your head? For most of us, we think of it as just one single condition. But what if I told you that's probably the biggest misconception out there? Today, we're going to break down the four main types of diabetes to see what really sets them apart. Let's get right into it. So, let's start with the big question. What exactly is diabetes mellitus? We all kind of feel like we know the answer, right? It's something about sugar, something about insulin. But the truth is it's way more nuanced than that, and that's where things can get a little confusing. Okay, here it is. This is the single most important thing to get straight from the beginning. We talk about diabetes like it's this one big thing, but it's not. It's actually a group of different conditions that just happen to share a common problem. And thinking of it as just one disease is where all the confusion starts. So how do we wrap our heads around all this? Well, we're going to use a really simple but honestly pretty powerful analogy that's going to help us unlock the core issue that ties all these different types together. It really all comes down to a key and a lock. I want you to imagine that your body's cells are like little houses, and they need sugar or glucose for fuel to keep the lights on. Insulin is the key. It's the only thing that can unlock the door to those cells and let the sugar inside. With every type of diabetes, something goes wrong with this key and lock system. So just remember that. Insulin is the key. All right, let's put that analogy to work. First up, type 1 diabetes. This is what we call the missing key problem. It's actually that simple. The body, for whatever reason, has pretty much lost its ability to make any keys. And here's the official definition. See that key phrase? Absolute deficiency? That's the whole story right there. It doesn't mean that insulin is weak or there's just not quite enough. It means for all intents and purposes, there is no insulin. The factory that makes the keys has been shut down. So, why did the key factory shut down? Well, it's an autoimmune thing. The body's own defense system gets confused and mistakenly attacks and destroys the very cells in the pancreas that produce insulin. These are called beta cells. Once those beta cells are gone, they're gone. No more keys. So for type 1, the takeaway is simple. The problem is a total lack of keys. The cells are hungry, the locks on the doors work just fine, but with no keys to open them, all that sugar is just stuck outside with nowhere to go. Okay, now let's switch gears and look at the most common form, type 2. Now, if type 1 is a missing key problem, you can think of type 2 as a faulty lock problem. In this case, the body is still making plenty of keys, but something's gone wrong with the locks on the cell doors. The clinical definition here gives us two really important clues: insulin resistance and relative insulin deficiency. Let's just focus on resistance for a second. That's our faulty lock. It means the locks on the cells have gotten kind of rusty or jammed up. They're resisting the key, even when it's right there trying to open the door. Because of this resistance, the pancreas has to go into overdrive, pumping out even more insulin, more keys, to try and force those stubborn locks open. And for a while, that can actually work. But, eventually, the pancreas just gets worn out. It can't keep up with that insane demand. And that's what we mean by relative insulin deficiency. There are still keys being made, just not enough to overcome all those faulty locks. So when you put them side by side, the difference is just crystal clear, isn't it? Type 1 is a problem of no keys, an absolute lack of them. Type 2 is a problem of faulty locks, an issue of resistance. And getting this fundamental difference right is absolutely everything when it comes to managing it. Now, beyond those two big ones, there are a couple of other important classifications we need to talk about. These are kind of like the special cases. First, you've got gestational diabetes. This is basically a temporary type of insulin resistance that can happen during pregnancy. Think of it like this. All the huge hormonal changes during pregnancy can make the cell's locks a little sticky or resistant. But the good news is, for most women, as soon as the baby is delivered, those locks go right back to working normally. And finally, there's this big catch-all category for a bunch of other specific types. You can just think of this as secondary diabetes. This is when the key and lock problem isn't the main issue, but it's a side effect of something else. For example, a disease like cystic fibrosis can damage the pancreas, which creates a missing key problem. Or certain medications, like steroids, can cause a faulty lock problem. So we've walked through the four main classifications: missing keys, faulty locks, temporary sticky locks, and secondary causes. But why does this even matter? Why is it so critical to tell them apart? It matters because the cause determines the solution. It's as simple as that. I mean, if your problem is missing keys, like in type 1, the only solution is to get new keys, and that means taking insulin. But if the problem is faulty locks, like in type 2, Your first step might be things to help fix those logs, like diet and exercise. Getting the classification right isn't just an academic exercise, it's the absolute foundation for getting the right treatment.
So, we've seen that really understanding diabetes has to start with knowing exactly which type you're dealing with. It's step one. Which, of course, leaves us with one final question to chew on. Once you've got that part figured out, what really comes next? What does it take to manage the condition effectively? That's something to think about. Thanks so much for joining this explainer.